In medicine, we don't look for money. Please, we need to make money because we need to live.
We need to survive.
If you feel sick, stop texting your doctor friend. Stop asking them what is happening. Go to hospital.
Okay.
Go to hospital. There are people who are not meant to be parents, and there are kids who are going through a lot, who need to be taken away from these people and taken to places where they can be loved, respected, and they can grow, where they're not scared, where they feel loved, where they are provided for fully without someone thinking you're a burden. Losing teeth when you are pregnant. Yes. That is
like why?
crazy.
I wish
So
if
much
you lost
all your
them,
teeth,
you regain them. I
no,
wish.
that's the thing, you don't. They're your permanent teeth.
Yeah, so I
Follow.
can't get any more. Hi guys, welcome back to A Dose of Health, the podcast where I give you not too much, not too little, but just enough information to make you make an informed health decision. My name is Dr. Hope. I've noticed the other episodes I haven't been introducing myself. Anyway.
For real?
Yeah, for real.
Okay.
My name is Dr. Hope Simiu. I am the host and I have a returning guest. We are so excited. But before we get to her, come out, just subscribe. If you haven't subscribed, please take the time now. Click the button, whatever it is.
Apple.
Please and thank you. Follow us on our social media, engage with us, and now over to our guest. She can introduce herself because she's been here before.
I have been. Thank you. My name is Dr. Lynn. Well, Lynn is better, but I go by Dr. Lynn if you meet me at work. When you meet me at home, I am Wamboi, Bobo, whichever you choose. I also go by MindFence MD on social media. I create content, but at this point, I'm in a phase where I'm trying to really define my own content, but I do know where I want to go with what I want to do. So with my skills and all that, but as regards my own content, kuna kitu.
And that's why we are here today. Yes. Now, before you start, because you know the drill.
I do know the drill.
A journey to inside out.
I knew it.
Where are we
I came
today?
prepared today. Very prepared.
Okay.
By the time I was coming. Okay, let's start by morning, because the day you can't have one emotion
For the whole day. It's true.
not possible.
Yeah.
Okay, maybe it's possible for you. I don't know. Let me not judge.
Yeah.
But for me, earlier today, it was, I don't know how to pronounce this, but it was Inuit. Like meh.
Yeah.
But not meh in the deep kind of connotation that Inside Out has, because that's a point where in adolescent life where you're really bored, apathetic, you have
really
no
meh.
emotions, you are so detached. I was just tired, I think. More often, it was tired, but the feeling was meh.
Okay.
As I was coming here, it was a bit anxious. Anxious.
Why?
It's a lot of things
Okay.
that I might not disclose.
Okay. No. Sawa too. As long as see Mimi, by the way.
See Mimi.
Okay. Now you can go
It is
on.
not you. Then I got here and I'm happy now.
Yeah.
Yes. now I'm
Elated.
happy. Happy. To also see,
Familiar faces. Yeah.
I was pointing to,
They know themselves.
they know themselves.
We call them the geriatrics in the room. we joke.
Yes.
Yeah, we are age mates. I think that's like a nice way to explain it, because it's afternoon. So you will have different moods during the day. I think for me right now, I'm happy. I'm so happy to see you again.
I'm so happy to see you too.
Happy
That's
New
amazing.
Year.
Happy New Year. Merry Christmas.
We'll continue until, if I see you today and we're in June, Happy
Yes.
New Year.
Kabisa.
Yes.
Eh.
Yeah. So now, I have a new segment.
Yes, you do.
It's called the Doctor's Seat. Question number 1. If you had to explain what you do to a 4-year-old, how would you describe it in 1 or 2 sentences?
I talk to babies every single day and I find out what is bothering them, and I aim to make them happy and feel well.
Okay. You don't talk to the parents?
Not really. Honestly, I interact for it like generally. I do talk to the parent, but when the patient comes in, the first person I actually talk to is the child.
Yeah.
No matter how small they are. Baba, Sasa,
How are you?
how are you? Are you doing well?
Yeah.
Yes.
Okay.
You banter kidogo and then now you go to the parent. Hi, how are you? My name is Dr. Lynn. Blah, 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 blah.
That's a good way to establish rapport. Acknowledge the
I
patient in the
acknowledge
room.
the patient because we're there for the baby. I'm there for the baby. The
Exactly.
baby is my patient.
Yeah, and then you calm the nerves of the parent. Sawa. Next question. If you had to rate your top 5 medical specialties, which ones would they be and why? More check. You know I'm going to laugh if you laugh. 1 to 5 in whatever
1
order
to
you
5.
want. Yeah.
I'll tell you what I was taught by a family friend,
Okay.
where they said you need to look at things that you love, but also look at what will make you money. And I'm system in medicine, we don't look for money. Please, we need to make money because we
It's
need
true.
to live.
We need to survive.
So I had 3.
Okay.
I just have 3.
Wow.
I don't have 5.
Okay.
It's
3
3 is
is
okay.
good enough. Yeah, it's more than half.
Pediatrics would
It's
be
number
number
one.
1 for me.
Aww.
Hands down.
You really love the
pediatrics.
little
I do.
humans. Cocofelons.
I do. Coco felons.
Yeah,
Those
they're
are
felons.
Toddlers, you know what? It's
Wait.
fine. Pediatrics, mostly because I love interacting with kids.
Yeah.
And kids don't pretend.
Oh, that's true.
They don't. And I know we'll say adolescents have some kind of thing and then they tend to grow up alafu hawataki kufanya vitu. But no, when you look deep down, there's actually something going on. So they're not really pretending. They're trying to cry out for help.
So
that's
when you
why I
say when you say
don't
peds,
pretend.
I know peds is like until is it 21
21.
these days? So even adolescents you enjoy. Okay,
Yes,
that's very
yeah.
nice. That's very
'Cause
nice.
the different ball game, but
Yeah.
they all need someone
Yeah.
to see them, to talk to them. Number 2, orthopedics. It's such I know it's so I swear and I knew ungereact.
Carpenter.
Imagine.
Hey,
Imagine.
Joseph mwenyewe.
But they have orthopedic surgeons who are
They're
working
carpenters. The orthopedic surgeons, you are carpenters in the best way possible. You have a toolbox and you fix the problem. Honestly, fundis of the body. Because the way when you have a broken
Okay.
part, they will fix you and they will put you back together.
Yes,
Yeah.
true.
And let me tell you, by the way, if you don't have strength, there's no way you're doing that job. And don't
Okay,
tell me
and I
otherwise. Don't tell me otherwise.
And I don't. But
Yeah.
also maybe think about it. You can be a hand surgeon. You can be a pediatric orthopedic surgeon. You can be you
so
can do
cute.
arthroscopy. Yani you are
Precision.
and nini, so those super specialties. Maybe work with spine.
Oh.
Like there are those super that don't require
With my
I wouldn't say they don't require, but yes, wacha niache kusema to see.
they don't.
But they don't.
They might not require like
when
a femur, the energy for a
when I
femur.
had interest in ortho like that, I was concerned about that, and then someone told me, "Apana, think about hand, think about pediatrics, think
Okay, that's a
about
good way to look
so I
at
was like,
it.
oh, okay, yeah. So there are avenues to
Yeah.
go into ortho, even if you don't really have the physical strength. Number 3 is psychiatry. I mean, obviously,
Yeah.
obviously.
Well, yeah, when you're the poster child for stop it. Stop it.
No, but for real,
Yeah.
a lot of things, I think experiences and also learning more about myself.
Yeah.
And I think that was mostly it. I think trying to discover what was happening and what was, I won't say wrong, but what was different.
Yeah.
Different about me. Yeah, that made me love
So in
psychiatry.
case you pivot, I know where you're going.
But
Yeah.
I'm not planning to do any of those.
I know.
Yeah,
I'm
thank
just
you.
saying in case. You never say never.
Yes. It is never.
You might be there at 40. You're like, guys, I'm ready to start my orthopedics journey right now. What, you're laughing and maybe it might happen.
Maybe. We'll come back to this moment.
We'll come back here. Be like, yeah, I was the one who told her. And she didn't want to listen.
It's
So
fine.
that next question. If you won a grant today, what problem are you solving? In health, what problem are you solving?
Is it really in health? Child protection laws.
Okay.
It would actually, I don't know if it's in health, but it actually,
It impacts
it
health.
impacts health.
Yeah.
Because I've seen kids, and I'll say this in the nicest way, but there are people who are not meant to be parents. There are people who are not meant to be parents, and there are kids who are going through a lot, who need to be taken away from these people and taken to places where they can be loved, respected, and they can grow, where they're not scared,
Yeah.
where they feel loved, where they are provided for fully without someone thinking you're a burden.
I agree. I agree.
I think, and especially, I think all this That's a good question, by the way.
Yeah.
I think it's because recently, after I went on a rant on my stories about
I saw
a
it.
child whose dad left, alimwacha tu kwa mlango ya hospitali. Oh my God.
How old was the child?
15, 16, thereabouts. And
that's
you
where
might
you
say,
just need to be
and that's where,
held.
and a lot had happened to him, and he was quite sick. He has a chronic issue.
Yeah.
In addition to his chronic issue, his oxygen levels were low. He was having fevers, so he's just walking, and he's in pain. He's tired. So you're asking him, where is your parents? Unaambiwa huyu alienda kitambo sana, aliacha mtoto hapo kwa mlango na akaenda. Only to come and find out after ranting all that much that someone actually DM'd me and told me this is not the first time ametoka kwetu amekuja huko kwenu, because us we were trying to hold him accountable. So that and then also another case which I don't even want to talk about it right now, but it happened 2 days ago.
Okay.
Where this is a bit deep, because this child's parents' mom died.
Okay.
And he was like, sayonara, and left. So the child has a lot of things that are going on with him right now. Teenagers bado too. So that's so now at that point, yes, child protection, and child does not mean ati babies.
Yeah. Until you're 21.
Until you're 21.
And that's the laws.
That's as in, if I could, in Africa 25, where your frontal lobe has matured, and that's why it would be covered.
I agree.
Yeah, so that is what I would.
Okay.
For.
And actually, adolescent health is very under-researched.
Yeah.
It's overlooked. So I think that's also a very good place.
Yes.
Okay.
But wait.
Yeah.
Can I plug someone about that?
Yeah.
Dr. Njeri Karianjahe. She is an adolescent medicine specialist.
Okay.
So yeah.
Where do we find her?
She's at Aga Khan. I think she comes to Gertrude's now. She still comes to Gertrude. I'm not sure about where she's at right now as regards Gertrude's, but I know she's going to Aga Khan as well. But we can maybe...
We'll put her
contact here.
Yeah. Because I think, the adolescents also need to be cared for. Higher. Next question. What's one skill or habit that you think makes you a good doctor?
Wow. A good question. And it's the communication, but am I lying? No, but communication.
Okay.
And listening.
Okay.
Listening.
So communication still.
Listener. Yeah.
Perfect. Ya kumalizia sasa. Today is Wednesday.
Is it?
The episode is going out on Wednesday, so act like today is Wednesday. Today is Wednesday. Ukitumia lugha ya taifa, tueleze mada ya leo.
Wait. Hope, is that you speaking in Swahili?
Ukitumia lugha ya taifa, don't judge me. Nasikia judged. Hey, listen. Camera, please. Ukitumia lugha ya taifa, tueleze mada ya leo.
Oh my God.
Mada is topic.
I know mada is topic. It's just that I'm wondering now. I hope I can't actually.
Nimepanic,
but also
communication. Okay. Hey, hapa tunaweza cheka.
Back to school.
You say that? I'm trying to bring Kiswahili back. Yeah, we really
snaps
need it.
For you.
Thank you. Even me,
Is this snaps or this? I know.
Whichever it is, all of them. We can't even do this. Yeah. So actually, why I have you here is because I saw some really good work you were doing with Gertrude's Hospital.
Thank you.
And it was such a great way of communicating the services that they have, but also a great way to teach the public. Tell us about that. Like, how did that come? Maybe you can start from your journey, content creation, and focusing on health, and just how your thought process is. Because I think you're a very good communicator.
Thank you. So, sometime in let's just talk about the journey. But sometime in November, we had, a committee where we do wellness for the hospital. So we're just starting out.
Yeah.
So during that process, we're like, okay, let's share a video with the guys in-house about the wellness thing, tell them that we have this. We had Zumba. Oh, it was nice. We had Zumba.
Yeah.
We had food. We had some time for socialization. Yeah. So create a video just telling people we have this event on this day. And I did that. That was a good video, I think. And guys, the person at digital marketing
was just like,
was like, this is fantastic. And I was like... maybe he did know I create content, but maybe not to the extent that I do.
Yeah.
So he was able to be like, can we work together on, I have this kind of topics for back to school. I was like, so what are the topics? Took the topics, and then I was like, watch and chambue a bit deeper. Let's actually see what more can we say. Fine, I can see you talking about these are the things, different topics, but if we're to stick to just back to school as a series, like let's dig deeper, yani what that involves, then we can get a bit more of content.
Yeah.
So that's how it started. On, I can be honest, from 26th of December,
Wait, the
I was
date is known.
working up until around 23rd of last month. It was working. I'm seeing patients, but I'm also shooting content. So we are shooting together. So I will script,
Yeah.
send him and tell him, okay, so this is what I'm thinking, this is what we're going to do. Sit and have a conversation. Okay, even the tutor shoot. At first, he'll be honest if he watches this.
When he watches this.
He watches this. He was very honest and said initially he didn't get my vision because, ADHD, neurospiciness. You have this flurry of ideas, and sometimes maybe I can see it in my head, like I can tell you exactly what I see, but if you've not done it with me before, it might be hard to execute the vision. So at least I did have the script, the short list, and then there's something I learned. Anytime, so you see, come up when you're right now we are talking, or you create your own videos. There's something called a word tree.
Okay.
So based off of your script, when you read your script, what are the words that pop out to you? So for example, so like let's use the first video I did. Back to school, there was something about shopping, height, weight. Those are the words that were popping out. So let's use the word shopping. Nikaandika. So you write all these words and then take that word, go to Pinterest and write visual inspiration. So shopping visual inspiration. It'll show you different things. So for example, a shopping cart. So that's how I ended up in a shopping
First of all, how did you get the shopping cart?
There is one.
To the hospital?
No, there is one in the
you
hospital.
serious?
Yeah, I knew there was one in the hospital.
Wow.
In pharmacy.
Okay.
Kuangalia tu vitu, and I was like, wait, I do know we have this.
Yeah.
The things inside, guys from the outpatient department really helped. Tuliingiza tu vitu hapo.
Yeah.
I'm like, nyinyi wazazi wenye mnapeleka watoto shule, buleta hizo pencils.
Yeah, 1,
na
2,
nini,
3, just
leteni
come.
tuangalie.
Yeah.
So, and then some of the things like shoes that were in the lost and found.
We can make good use of this.
Let's just use this.
Yeah.
Because, it's more of, so the word tree.
Yeah.
All that. So coming up with a concept, shortlist, everything. Alafu now explaining it to the person who you're doing it with. And then they help you execute. And then now editing. Editing has been, for me, the nightmare.
You edit yourself?
Yes, I edit myself.
Wow.
Yes.
Able to pick my coffee. It actually looks very...
Thank you.
I'm not saying you're not a professional. But it looks professionally done.
Thank you.
Yeah.
Yes, I edit myself.
Where did you learn?
YouTube. There's a guy called Colin.
People are taking
on
notes.
YouTube. Are you taking notes? YouTube. There's a guy called Colin.
Yeah.
But also Skillshare.
Okay.
A lot of Skillshare. And what's this other platform? Coursera.
Oh.
But Coursera, not so much. Actually, funny enough, Skillshare. Actually, it's Skillshare and YouTube.
Okay.
Yes. And Pinterest. Yeah, that's the other place. Pinterest.
Oh.
Pinterest.
Okay.
And then there's some creators who purposefully create so that you can learn how to edit. I'm forgetting. There's a guy who every single, like if there's a trendy video, they will show you, oh, this is how this person created it. And you're like, oh, interesting. Okay, sawa. Yes.
Oh, that's so interesting. Now, before we continue, let's see if you remember, what are some of the things you talked about in the video?
Interesting. We talked about weight and height. But there's something I wanted to actually say there. I couldn't say a lot because we had to trim it. Weight and height, it's so important. Apart from that, but nutrition aspect, just generally having at least a HB done, full blood count done.
Thank you.
Vitamin D at least checked. Any these basic things, because even those micronutrients things, they really impact on mood.
Yeah.
Mood and even how tired are you, how energetic are you rather, and attention span. It affects a lot, memory.
So your ability to
So
thrive,
yes,
basically.
so if you can have blood work also done, I couldn't have put that up. The video had to be trimmed.
Yeah.
But if you can also have those things done, because you probably have anemia and a child is struggling to stay awake and they're feeling tired all the time, maybe they're anemic, and that could have been corrected and the child is okay.
Yeah.
Or vitamin D deficiency, they're complaining about pain all the time, they don't want to wake up, they're moody, wondering what's this. Kumbe ni vitamin D is deficient.
Yeah. Actually, you've said that, and there's something I was reading about diet. I keep telling people it's unfortunate that as doctors we are not nutritionists, so we can't answer everything
That's the
about
thing.
nutrition.
Yeah.
Like we just know bits and bobs.
Yeah.
But just because your child eats well doesn't mean they're well nourished.
Yeah, that's the thing.
Yeah.
Eh.
What are they eating?
That's the thing. What are they eating?
Yes.
Here's party. I'm eating pizza. The child eats well. Of course, they'll eat pizza well. They'll eat fries well. They'll eat ugali and something else well. But you try offer them
vegetables. You're like,
then we're not eating.
Yeah. And this also includes children who are small. You know, I know we focus a lot on children who are clinically obese or like bigger in size, but even smaller children
kids,
are micronutrient deficient. And this is like your iron, your vitamin D, calcium, and the like. So it's about the quality of food you're eating and not the quantity.
I'll be honest. Sizing now as a parent to a toddler.
I understand. Don't worry, I understand. I mean, my auntie did it. I understand.
You have seen them and eating and fighting?
Yeah. Yeah.
We need someone to actually tell us what to do, because, like, for real.
No, this is where you come in. Effective communication.
To a 1-year-old.
To a 1 year. Now we need to train how to just sneak healthy treats here and there.
For me,
treats, they're not animals. Healthy things.
I think honestly, Hapo, for me as a doctor, I'm going to say honestly, I need some help. Hapo, like genuinely, a lot of us need, because you think you know.
Yeah.
Until your baby shows you, baby, how would you?
Maybe this is where we welcome nutritionists.
Yeah.
Like for real.
For real.
Please just draft a comprehensive meal plan for me, and please note that my child is very picky in terms of how they eat. Maybe they don't have good appetite. Like, how do I work around that to make sure that even if they're eating kidogo, they're eating the right thing.
It makes sense.
It makes sense. I'll look for a nutritionist, because I think that's a great conversation. So weight and height. What else did we talk about?
Talked about, as you can see, eyes.
Yeah.
Did I tell you I lost my right eye? You know what? We'll talk about this
you lost
later.
your right eye?
This eye doesn't see so well.
Okay.
After the girl with the list, you know.
Where is the girl with the... This is after pregnancy.
Yes.
The girl with the list. Come to the front right now.
Yeah.
Honestly, every day.
Every damn day.
Every damn day. Yes. You make me I'm just like, you guys.
Yeah.
Have you gone to see a doctor about that?
So that's why I went and got these things.
You never used to wear glasses?
No.
First of all, these things, they're called glasses.
Sorry.
Yeah. Some of us have lived with them.
Sorry, Mama.
Yeah. They're called glasses.
I have to laugh at my sister because I'm like, kipofu. No.
First of all, it'd be your own. You see yourself now.
But it used to be so funny.
I know.
Because I'm like, you're blind, Mama. My
God, when we were kids, and then we used to have
my vision was, what's a 6? I was 6/5. Like, I was seeing, you know, people who are like perfect fish, like can see so well.
Not anymore.
Not anymore. Not anymore.
Now about the child who can't see page 17, and that's why they're not doing well.
Yeah, so vision and also hearing.
Yeah.
Then number 3, what did I talk about? Should have been vaccines. And the importance of getting at least the yearly vaccines that the child needs to get. It will not prevent the illness completely, but it will prevent you from getting to a point where it would be, I don't say death, but you know,
severe.
We don't want to get severe. Then 4, what did I talk about? Oh my God,
trying to remember. Okay.
What did I talk about? Oh my God, this is how you know my memory is just something else.
Let me repeat
Number
them.
4.
Weight and height.
Yes.
Vision and hearing.
Yes.
Vaccines.
Yes.
Uh-huh.
Then number 4 should have been, okay, let me say, was it infections?
I don't
know. Chronic illnesses, like kids with chronic illnesses.
Kids with chronic illnesses.
Who can come and we can assess them. There were 6 things. I don't remember super because
We'll put the other
we'll
three on
put
the
the
list
other
because I think
yeah,
they're
'cause-
very important.
yeah.
So now my question would be, what was your thought process when you're now picking these 6 things and back to school? Because I think that was a very great way to bring in the parent.
Yeah, I think it was trying to address every single thing a parent can think of. So, or the things they may also overlook.
Yeah.
For example, the very first part of the weight and the height, the nutritional status of the child.
Yeah.
We ignore that a lot, and you assume it's so many other things, but you have not addressed that. Also, peer the vision and hearing. So, for example, I had a patient, was it yesterday? Should have been yesterday, who said, I've been given classes, but I don't see with them anymore. But they've come because their child is having a headache. But they're having a headache because they're straining to see.
Yeah.
And it had been there for months. So Nile, you're like, we are ignoring an obvious thing. It's the eyes.
Yeah.
Or others who have hearing issues. Hearing, and sometimes it's just wax that has blocked. It's a lot, mpaka they can't hear you
impacted,
genuinely. It's impacted. So it was more of looking at what is being overlooked or what you may assume, and what are the things that even I as a parent, what would I ask? What would I want to know? But then how can I be prepared?
Yeah.
I think I looked at it as tunakongana back to school shopping list.
Yeah.
What about back to school health list? Makes sense?
It does, yeah. Now, question. Do you think infections come back when children go back to school? And do you think that is an explanation of their low immune status? Or
Elaborate that question.
do you think that low immune status and back to school homers are related? Or do you just think it's because of the hygiene? Not hygiene, but the children touch everything. They're just everywhere in general.
I think it's more of that.
It's more of that, yeah?
Because if we're to say fine, it can contribute maturity of their immunity.
Yeah.
It can contribute to some degree, especially when they are younger. So they've just started school. They've been home with you for 2-3 years before they started going to school. And then suddenly they're exposed to everything.
All at
and
once.
Everybody.
Yeah.
So imagine mimi, wewe, kila mtu hapa tumetoka kwetu. We all have our own things. And this is the first time you're being exposed to. Your immune system has to learn. Oh, but this is this virus. This is this. It has to learn.
Yeah.
To some degree, yes. But we also need to remember there are other factors that contribute.
Yeah.
The sharing, the kissing, the hugging.
Yeah. I mean, they're just children.
They're babies. You can't tell them, Mama, watch out. No, this is my best friend. Mwah.
Exactly.
They do that after they've met on the playground 2 seconds ago. They hug and they kiss each other.
That's true.
It's bound to happen.
And the next thing, homework.
But usually we tell parents, by the time they're kiddo 5 years, kiddo is, by the time they are about 5 years old, they tend to be, it's a bit better.
Yeah.
It gets better. It gets better with them. But those first 5 years,
prepare, get used to it.
Utakimbia.
Yeah.
But yes, there's a degree of, let me not say low immunes, let's say immaturity of the system. Like it doesn't know a lot. It's not been exposed to a lot.
Yeah. And I think why I was asking that question is because many of us just say that, they have a weak immune system. And that's not necessarily the case. Like they're just adapting to the exposures. And that was number 4. I think you said hand hygiene.
I did?
I think in your...
No, that was
there was no hand hygiene?
No, that was... No.
That was the second video?
I think that's the second video.
Oh.
That's the second video. Yeah.
Okay. So is this going to be a continuous series?
Yeah, it should be a continuous series.
Yeah.
Yes.
Okay.
But only, of course, back to school now.
So now it'll be, okay, fine, back home. Back outside.
But these are videos that can be used over and over and over again. So yeah, it should be a series.
And we call them explainers. And I think why I was so curious is because it's a very interesting way to tap into the parents so that they can understand, actually there's more here that I can do before the child goes back to school, and not only focusing on school but just annually. The way for us as adults we say, an annual checkup is so important. Even for the kid, it's actually important. Now, does Gertrude's have like package? Do you guys have like packages, or how do you position it?
We at this point, maybe you can just come and say you want a medical checkup. After I think a conversation with a doctor, that way we'd be able to know what do you need, what advice can we give you, what tests can we do at that point. Do we have a package? As of now, not yet.
Okay.
Maybe it's something we actually should work on. That's good feedback, actually. It's something we can actually work on. But yeah, it's more of a consultation.
Yeah.
We do tests, and then we can send it to also our Well Baby clinic. I know it's called Well Baby, but that's where the vaccines are given.
Yeah.
So Well Baby, you are well.
Mm-hmm.
So it's more of that. Then you
Yeah.
also have our nutritionists on board. They are around, so they're able to have a conversation on that. I've remembered the other point.
What are the
was
other ones?
sleep and no, that was the you know what?
That's the
It's
second
fine.
video. But let's talk about
Yes,
sleep.
yes.
Because something that I think we don't really pay attention to is the effects of poor quality sleep or lack of sleep.
Yes.
So how does that manifest in a child?
Irritability.
Uh-huh.
Then this is so sad, but especially when they're younger.
Yeah.
I think it's because I experienced a patient who passed out in school.
Fainted.
Fainted.
Okay. I'm seeing the quotes.
But he was just so sleepy. It was a girl. She was just so sleepy. So she just wanted to sleep. She was 6 or 7. She was so young.
Yeah.
She just wanted to sleep. After Amekuja, she was like, I just was sleepy. I just wanted to sleep. Yeah, and that's where you're like, okay.
Like, just
you need
sleep,
to be
mama.
serious.
It's okay.
Lala too.
Yeah.
I think also saizi, I'm loving the parents right now who are quite a number of them. Mtoto amechoka, hataenda shule.
Like one day won't finish
it
anything.
Won't finish anything, especially when they're younger.
Yeah.
Because you see school buses at 6 a.m., 5 a.m. in the morning to take kids.
5 a.m.
For what reason?
And they're all just there like this. They're all asleep.
Off.
I'm like,
yeah.
wow, what time did
And
you
I
wake
think
up?
poor performance. That's another thing. Poor performance. Mood is disrupted.
Yeah.
Think about yourself without sleeping. How moody, how horrible your day is, how you can't concentrate.
How horrible of a person you will be.
You will be. And so you are in a position where you have classmates.
Yeah.
You have teachers. You have tests you probably need to do. You have homework you have to do.
Yeah.
You have friends you need to keep up with. You will be, it will not be good.
That's true. Yeah.
So sometimes they end up coming with, as they get older, this is a medical somatization, so they come with also, I wouldn't say that is the cause of, because psychiatrists can come for me right now. I will not say that, but as in they can come with other, many mental manifestations, physical manifestations of what is happening mentally.
Yeah.
And poor
they're just
sleep,
tired, probably.
and poor sleep contributes to that.
Yeah. And poor sleep is not just quality is actually very important. Kuna kitu ingine nimekumbuka.
Uliza.
Now, you said poor performance, and I remember in med school, one of the contributors to poor performance we're told is worm manifestation.
What manifestation?
Worms.
Oh, yeah.
Worms. And that is why deworming your children every 6 months is so important, because they're just sitting there and then they're feeling itchy, or they're not they don't sleep well, they're not eating well, and then also the worms are enjoying their nutrition as well.
Yeah. Deficiency and it's just a whole thing.
Yeah. And I like, last year, when guys were doing the during like Christmas season, where you gift your friends, and then it's like you buy this, me I buy this.
Yes, I saw that.
So a group of some friends of mine, one came with deworming medication. I was just like, you know what? That is a girl after your own heart.
A gift.
Yeah.
A
gift. So if you haven't dewormed, please, we're in February. This is the time. And then 6 months later, also remember to deworm again. Now we've talked about a lot of health. Yes. Where do you see this going? Because I think it's a very good way to bring in, I don't want to say the patient, let me say the client, into just the know about their health and their children's health. Where do you see this going as what Lynn is doing? Would you want to make it bigger? Is it something you'd want to pivot into? What are you thinking?
I do. I do want to pivot into that. This is going to be bigger, yes.
Okay.
But when it comes to pivoting, I think for now, I want to pivot into a completely different thing. That's why I was saying.
Not even this one?
Not even this one.
Okay.
Not just this.
Okay.
Let me not just. No, let me not say not just. Let me not say that. But as you said, there's never, I cannot say it will never happen. But at this point in my life, it's more of, I want to go into marketing, content creation, be very broad, work with whatever, Of course, health-related companies would
Okay.
help a lot because the knowledge that I
It's
do
there.
have,
Mhm.
so it's not, I won't
It's
say
not too much of a
easy, it's not-
struggle.
yeah, yeah. So I'm
Yeah.
using, and also I'm using skills that I already have, the
Yeah.
knowledge I already have.
Mm-hmm.
But I am open to also working with, it's marketing.
Mm-hmm.
It's telling stories.
Mhm.
Actually, that's what it is. That's what I want.
Storytelling.
Storytelling. That's
Yeah.
it. That's what I want.
Have you always been a creative?
Yes.
Okay.
Has it been explored now at this time? Yes.
Okay.
I can say maybe after motherhood. Yes,
After
it has
motherhood?
been. Yes.
What did motherhood
After
change?
motherhood, I think motherhood. It's funny. Aki, this is not a conversation about motherhood, but you know
It's
what?
not. It's not. But
Yeah,
it's part of the
but
journey.
it's part of the journey, and
Yeah.
I think something switches in your brain.
Mm-hmm.
Everyone says, Aki, I cannot explain what it is, but
Yeah.
you wake up and you're like, hey, this is what I want. I'm going to
Yeah.
go after it now.
There's like a boldness that
There's
comes
a
with
boldness, there's a I don't care what anybody thinks, what anybody says that comes with it
it. Mm-hmm.
as well.
Yeah.
And there's also that you want to prove so much to yourself and to also show your child, by the way, you can always go after things that you want to go after.
That's true.
Eh,
Hey, look at me saying that's true. Nikama najua.
you can relate.
I can see,
can
not
see
relate. I
as a-
can see. I think, and I say this very confidently.
Yeah.
Most of my friends who have become mothers, you can just see the boldness that
Yeah.
they've gotten after that, and they just go for whatever it is that they want.
After Kuza, let me tell you,
Yeah.
let's not get into that. We'll talk about this later.
That's so interesting. Okay, fine. Now, question to you.
Ask.
Okay. Now, you see the bags that children carry, the school bags. Do you think, no, this is an honest
okay.
question. Do you think children are going to have back pain? I feel like they're carrying very big bags. You're laughing. It's a very honest question. I see kids carrying such big bags.
No, it's true because they come actually saying, Dr. Mwana Mgongo.
For real?
Yeah.
Wow.
We've sent kids to physio.
Because of a heavy bag?
Yes. No, I wouldn't say because of a heavy bag. I think
okay.
because they come complaining of back pain. Now that's actually a very good point. Why have I never thought about the bags that they carry? Because you think about every other thing, their posture, their beds.
Kwanza the bed is a
when they're
mattress.
in boarding school, because boarding schools are also very strict on, you can only come with this mattress, you can only come with this kind of pillow. Some of boarding schools are like that. So I think that's what you think about. Back pain, yes, I have seen. It can, yeah. But that's what do we do about it at this point? Because now they come with homework. They tell you it's homework. A lot of homework.
That's like getting a proper chair. And something I actually want to go into this year is also ergonomics.
Yeah.
Like your setting for your work or your school, your setup needs to accommodate your back, your posture, so that at the end of the day, you're not like, wow, I've been bending for such a long time, my back is hurting, I've been straining for such a long time. And even especially for kids, if you're doing homework for a very long time, is the lighting good for you? And also watching the TV, are you too close? Are you also too far? Because now you're straining. Even for a student who has probably visual challenges, sitting at the back might not be the best for them. They should be in front. So I think those are just some of the small things that we can see from kids. Don't have a kid standing there doing this and then you're just like, anakwanga hivyo. No, that's something we should probably explore and address. Anyway, that
oh, wait, let me ask you a question. How would you address that with teachers?
Like where the child sits,
but say carrying heavy bags, mostly the heavy bags, because I know the challenge usually is the challenge usually is they'll tell you they have a lot of homework, so what do I do about that? Something we need to think about.
I think so.
Because sometimes when you also try to challenge teachers, I love you because you have brought us to where we are now.
Yes,
but sometimes let's cooperate, let's work together.
I don't know how I would address that. I think sometimes maybe the bag itself is heavy. Let's just start there. And then also, do you have to carry every book that you've carried today? Maybe we can remove one or two. And then also, if you can have, like if you're going home for the weekend, I don't know if you can have some books at home and others in school. I don't know if that works.
I don't know, but now that I don't know.
Yeah,
that's something we actually.
I think it's just something to explore.
Yeah, because to get from a point of
I can't see it in
I
a
also don't
Jua,
know. Yeah, I
but I've
also
just
don't
always
know.
wondered. Some of these children are carrying such heavy bags. And I'm just like, if the child, I saw this thing that said, if the child probably looks like, if the bag probably looks heavy, it is heavy. Yeah. So I don't know. Yeah. Anyway,
Interesting.
anyway, it's good. Now, last question. Do you enjoy doing the work that you've been doing with Gertrude?
Yes, I do.
Yeah.
I do enjoy it.
You do.
It taps into my creativity. I'm able to, I'll be honest, this is the only thing I can do and work overtime.
Okay.
Yani, I can sleep like 2-3 hours and I'm awake and I'm like, let's go.
HR.
Let's go.
She said, hey,
Let's go. But try your part. Cast that part. Because I cannot be saying, you know what, it's fine. But the thing is, I love it. I love it. I love the scripting. The one place I will be very honest about, I don't particularly enjoy should be editing. I love it, but the end product is okay. But
yeah, you can
by
always
the
get
time
help.
we get now, okay, I can.
Yes,
No,
ma'am.
this is where
Yes,
the
ma'am. You can
OCD
always get help.
Yes.
Yeah.
This is now where the
OCD comes in.
yeah.
Okay. Okay. If you open up room for help, it will come and it'll ease the load that you have.
Thank you.
Yeah.
I'll think about it.
If you're a good communicator, you can communicate your vision to another person. Sawa. Okay. Okay. But I think I just wanted to have this conversation because I like the work that you're doing.
Thank you.
I think it's a very great way of communicating, and we are in the business of empowering people to become informed patients when the time comes. Yeah. All right. So Tuki, wrap up.
Yes.
We were in the doctor's seat.
Yes.
Now we're going beyond the clinic.
Okay.
Question 1. If you had to text one simple, actionable health tip to all your patients right now, what would it be? Just one tip.
Go to hospital at night. If you feel sick, stop texting your doctor friend. Stop asking them what is happening. Go to hospital.
Okay.
Go to hospital.
Is this catharsis for you?
Yes.
Okay.
I felt so nice.
Okay, but no, it's true. Go to hospital.
Can I give a second
Yes,
one?
you
There's
can.
another number 2. If you do have a friend who is a doctor,
Yeah.
9 times out of 10, you'll be able to get an answer if you text them over calling them.
Okay.
Unless they specifically tell you, I prefer calls.
Yeah.
Just text.
Okay. They've had. Question 2. What's one thing you do for yourself, either in the morning or in the evening, that's just for your sanity?
I sit in my car in the evening for about 30 minutes and listen to music alone.
That's a good one. There's something sitting in the car does.
I know.
I don't know. There's just something. Yeah, even me, I love it so much. Yeah. All right. Number 3. Was there a moment recently or in your training, however long ago, where you just sat and thought, the body is wild for doing that?
Was there?
Or is there?
Interesting. I've never really thought.
It can even be from your pregnancy journey. That's where most of the wild stories that I hear come from.
I think no. Because everything is no.
Or from someone else's experience.
Funny enough, okay, yes. Losing teeth when you are pregnant.
Yeah.
Yes.
Yeah.
Yes.
Yeah.
That is
like why?
crazy.
Why? I wish if you lost them, you regain them. I wish.
That's the thing, you don't. Yeah, because they're your permanent teeth.
So I can't get any more.
Yeah, Josie actually saw a woman who lost 8 teeth.
8 teeth.
For 1 tooth for every pregnancy that she had. It was 7 teeth actually. So she has 7 kids. So in my head, what happened? I will have that discussion.
It's crazy. This is not even a funny story, by the way. So I took my mom to the dentist recently, and the dentist was talking about just a similar situation where there's a lady who would lose teeth due to her pregnancies, and of course it affects your nutrition because how you eat, you can only chew on one side, you're not chewing effectively, so that affects your absorption. I was just like, where? So by the way, guys, please go to your dentist, go for your dental checkup. It's so important, please.
And I think this ties in piano prior to also getting pregnant.
Mm-hmm.
Your nutrition, how you're preparing yourself
Mm-hmm.
to get pregnant.
Yeah.
It's really
Oh, yes,
important.
yes,
Remember the
yes, yes.
pre-pregnancy?
Yeah, the preconception.
The preconception care, like that is also,
Yeah.
that also factors in a lot.
That's true. And now also for kids, since you're talking about the kids, they should also go for their dental checkups.
yes.
Yeah. Kaujiongeza in the next video.
Nitaongeza. In fact, sasa juu umesema nitaongeza.
You guys have a dental unit,
Yes,
yeah?
we do.
Yeah,
We even
please.
see adults,
Gertrude,
by the
we have a
way.
new topic for you.
Yeah, and we also do see adults.
Do you
For
know that's
dental.
What about for other things?
For other things, no.
For real?
No.
So if an adult is having an emergency?
We will attend to you for your emergency and do what we can at that point. We will never turn you away. We can't turn you. We're a hospital.
Yeah.
So we'll attend to your emergency, and then once we've stabilized you, we can refer you. If it's something that truly we cannot handle, we'd rather send you, at least something, but stabilize you as fast as we can, but send you out as fast as we can.
Okay. But for dental, adults can.
Dental, yeah.
Okay, I didn't know that. So I've learned that today. Next question. What's a piece of health advice that you give, or rather that you were given 10 years ago or like years back, that you changed your mind on? Like you no longer are inclined to follow it?
Wow. Before I answer, do you have an answer to that? Or you're
struggling to follow it? Let me say struggling. I think for me sometimes it's sleep. And why I say sleep is because imagine sometimes you just might not be able to get that 6 to 7 hours, 6 to 9 hours.
That's the truth.
But the thing is try.
Yeah.
We say try, but you might not be able. I think another one is it's nutrition. It's nutrition.
I wanted to say that.
And this is coming from someone who, I wouldn't say I was force-fed as a child, but I just didn't have interest in food. And sometimes I just feel like, just leave me.
Yeah.
Like, just leave me, please. Because I feel like now at the end of it, you develop a negative relationship with food. Yeah. So I'm not saying leave the child, but I'm just like, try and move at their pace.
Yeah. Normally we tell parents, okay, I won't say we, I'll say I tell parents that.
Yeah.
Because I tell them if the child has refused, achana nae. Actually, legit.
Ataskia njaa at some point.
Those are the exact words I use. Ataskia njaa.
Na atakuja, by the way.
Now the thing is, akisikia njaa, si ati uanze offer now sasa the milk that you offer what you had wanted to offer. They will actually eat it.
That's true. Hey, when you're hungry, you can't choose. Yeah. You will eat what is there.
You will not choose.
Yeah.
What's something I have struggled with? I don't. I don't.
No. I think maybe I would say struggle with, not like I don't follow it anymore. But let's be honest, sometimes brushing your teeth twice is hard.
It's so hard. It can
sometimes
be hard.
It's hard.
It can be hard.
Yeah, but we try. The dentists, we really try our best.
It can be so
we
hard.
try our best. But imagine you're there in bed and then just like, oh, I haven't brushed my teeth. It's okay. Yeah, so that one I struggle with. I'm still for it, but I struggled with it. Yeah.
To be fair, to be honest, for me, I think if I agree with something, I agree.
Okay.
If I don't, I don't. It's very hard.
Yeah. Interesting.
Yeah.
I've remembered. Sorry, this is the last one. Then we move to the last question.
It's okay.
Rinsing your mouth after brushing your teeth. Yeah, I don't.
God,
all the dentists on TikTok are just like, you're wasting the toothpaste. Now you've brushed and then you're rinsing it away. Yeah, so brush your teeth. Don't rinse.
Yeah.
Let the toothpaste do the work. Yeah, you can just like spit it out, but don't rinse your mouth after.
That one.
No, that one I follow.
I don't.
You don't follow?
I don't, because I find that taste
bad.
Horrible, yeah.
Okay.
So horrible.
You'll work on it, don't worry.
I'll work on it. I'll try from tonight, because, let's see tomorrow morning.
Okay, you have a lot of things to work on.
I don't struggle with it.
Last question. Mm-hmm. What's a health rule that you think we should all break every now and then without feeling guilty?
Taking coffee. I'm sorry. Taking coffee. I'm sorry.
Who refused you to take coffee?
No, people don't. I'll say that I am known as a coffee
addict. How many cups in a day?
Hope Take coffee. Does it? No, you're doing the thing. Stop judging.
Me, I'm not judging. I've asked a
Are we taking coffee or not?
Me, I've asked how many cups in a day. Okay.
Just
Okay.
let it be.
Okay. So take coffee. Every now and then. Just have
Take coffee.
as many as you want, and then
Take
revert.
coffee. Take coffee.
Okay. So. And on that note, we will end there. We will just say,
Thank
please
you.
continue the good work.
Thank you.
We are learning.
Yes.
The parents out there are learning and they're
Yes.
enjoying it.
Yes.
It's very interactive, very engaging.
Thank you.
Hopefully, this can also go to schools. You know, schools are also a good
that's the
place
thing,
to learn.
Yeah.
So if you want, now is the time to plug yourself.
Yes.
Yeah.
Let me plug myself.
Okay. Yeah.
First, before I plug myself,
Yes.
I'll say you can come to Gertrude.
Yes.
Come and be assessed by our amazing pediatricians, our amazing nutritionists, our amazing specialists.
Yeah.
Our well baby vaccine. Come and learn about the services that we have. Actually, check us out on Instagram,
I
on
think I'll put
TikTok,
the-
LinkedIn, literally any social media platform, TikTok, that we have out there for anything that you actually need. This is whether in Kenya, outside Kenya, we are there for you.
Okay.
For myself,
Yeah.
I am MindFenceMD on Instagram. As I said, I'm trying to figure myself out at this
I was going to
time.
ask, are you going to see more of you?
Yes, hopefully yes. I think I have a better grasp on what I want and what I am thinking right now.
Yeah.
It's just been a bit of a struggle postpartum, figuring out this is what I want to do, this is what I want to talk about, and also trying to filter myself out. Because if I actually honestly said the things I want to say,
Cancel.
cancelled
Immediately.
quick, fast,
Yeah.
or trolled, I probably
Yeah.
would be trolled. So,
Okay.
so
Sawa.
I'm trying to learn how to filter that.
Yeah.
And yeah,
Okay. When you are ready,
when I'm ready,
we are here to receive you.
At this point, it is.
It's now.
It's now.
Okay.
Do you know Kev on stage?
Yes.
He talks, and there's a video he put out and said, just take the video.
What do you mean just take? Oh,
So
just
out
record
of-
it.
Yeah, like
Okay.
out of the thousands of videos he has done, say like last year, he only wanted to record 25.
Wow.
So it's not about, that's another thing I'm actually working on right now. It's not about feelings.
Yes. Yeah.
No, it's not about feeling. Something has to be done. It has to be done.
Yeah. Don't go with your mood.
Yeah, don't go with your mood.
Okay. I think that was me yesterday. I was
I saw, in fact, I
PMSing.
wanted to tell you, congratulations. Hey, Mama, good.
Thank
Good
you.
job.
Thank you. I don't
You
get
watched
I'm
the
just like,
work.
I'm tired, Grandpa. I'm tired. Oh my goodness. It's not TikTok. It's app. It's a movie. I'm told I speak in TikTok, but guys, the app has me like this. Anyway, for me, my name is Dr. Hope Simi. You can find me on all my socials, which will be down here. You can also please subscribe to this channel.
Yes.
Follow us on TikTok, on Instagram. Everything will be down here. And also follow us on Spotify, Apple, Amazon, and anywhere else you listen to your podcast. And let's engage in the comment section. What do you think she should do next on the Gertrude's page? Because she's doing a great job.
Thanks.
And if you've been learning, please let us know what you've learned from what she's already put out right now.
Yes.
Sawa. That's a wrap. Thank you for coming to our TED Talk or our yapping session.
Yes.
Bye.
Bye.